everyone, and welcome back to Athlete Resurgence. This video, we're going to be talking about something you've probably used within your athletic career, modalities. Things like ice packs, heating pads, compression sleeves, all the tools to help manage pain, swelling, and stiffness. But let's get real. How do you know which ones to use and when? Let's break it down. Please remember, this is just a quick description of modalities, so if you have any questions or concerns, please talk to your doctor or your trainers. Let's begin with ice. Ice helps reduce inflammation, swelling, and pain, especially during the early stages of an injury. So, when to use it? Right after an acute injury, like a sprain or a strained muscle, in the first 24 to 72 hours post-injury, and when there's visible swelling or throbbing. Next, how to use ice. Apply ice for 15 to 20 minutes, then remove it. Always use a barrier like a towel and don't put it directly on your skin. You can repeat this every couple of hours, but don't overdo it. And pro tip, ice is best for calming things down. It numbs the area, slows down inflammation, but once swelling goes down, it might be time to switch things up. The next modality is heat or thermotherapy. Heat is your go-to when you're dealing with muscle tightness, stiffness, or chronic pain, not acute swelling. When to use heat? Before an activity to loosen up tight muscles, during the later stages of recovery when inflammation is no longer present, or for chronic conditions like ongoing back pain or muscle tension. Next, how to use it. You can do moist heat like a damp warm towel or a heating pack. Apply for about 15 to 20 minutes, and don't use heat on fresh injuries. It can increase swelling. So pro tip for using heat. Heat can help improve blood flow and flexibility, so it's great before stretching, workouts, or rehab exercises. Next is the use of compression. Compression helps control swelling and provide support, especially for joint injuries. When to use compression? Right after an injury alongside ice and elevation, for ankle sprains, knee injuries, or general joint swelling, or during activities to reduce fatigue and provide light stability. How to use compression? Use compression wraps, sleeves, or elastic bandages. It should feel snug but not tight enough to cause numbness, and combine with rest, ice, and elevation for best results. Compression is a great option when you're moving around, but still need a little bit of protection. Elevation and rest. These may seem basic, but they matter, especially early on. Elevation. Raise the injured area above the heart level to reduce swelling. And rest. It doesn't mean complete inactivity. It means relative rest. Let the injured area recover without putting extra stress on it. Next, electrical stimulation, or TENS. So there's two popular uses of electrical stimulation. First is TENS. TENS targets nerves to reduce pain. And then second, there's NMES. It stimulates muscles to help with movement and prevent atrophy. When to use it? When you need pain relief without medication, when you're trying to reactivate weak muscles during rehab, or when you're working with a physical therapist or athletic trainer. How to use it? Usually it is applied with a professional, but at-home units can be prescribed. Pads go on clean skin around the injury site, and you never place pads on open wounds, directly over the joints, or on your eyes or temples. Another modality is ultrasound therapy. And this is not the kind that is for imaging. It is a therapeutic ultrasound, which uses sound waves to help promote healing deep down into the tissues. So when is it used? You use it when you're dealing with chronic soft tissue injuries like tendons or ligaments, when you're working with a provider in a clinical setting, when you need deep heat to hard-to-reach joints. How it works. A gel is applied to your skin. A wand is moved over the area, delivering sound waves that may help circulation and healing. Last is massage therapy. Massage helps improve blood flow, reduce muscle tightness, and ease pain. So you use it when you're experiencing muscle soreness or tightness, especially when you're trying to increase flexibility or range of motion, or when you need help relaxing after an intense training session or during recovery. Types may include sports massage for targeted relief, trigger point therapy for deep knots, or myofascial release for connective tissue tightness. Pro tip, even simple self-massage with a foam roller or a lacrosse ball can even be effective. So for a quick recap, first, ice is used within the first 72 hours for swelling and pain. Heat is for the later stages of stiffness or of chronic pain. Compression is for ongoing support and swelling control. And elevation and rest is always helpful in the early stages. Some things to watch out for. Don't use ice or heat for too long. Again, 15 to 20 minutes is kind of the sweet spot. Avoid applying it directly to your skin as it can cause skin damage. If pain worsens or swelling does not improve, talk to your athletic trainer, physical therapist, or your physician. And for the final thoughts, knowing when and how to use these simple tools can really speed up your recovery and help you feel more in control along the way. Remember, recovery isn't a one-size-fits-all. Pay attention to your body and what it's telling you, and use these modalities as part of the bigger strategy, not the only one. Explore the rest of the Athletic Resurgence platform in these videos, tips, and tools to help you get back to what you love doing, on and off the field. And remember, you're not falling behind, you're just building your way back.